Originally from Guatemala, Dr. Vasquez has served Huntsville as an interventional cardiologist for almost 19 years. With Huntsville being in the heart disease belt, he wanted to share the three main types of heart blockages you should know about.
Electrical blockages, which are the ones that usually require treatment with pacemakers. You have blockages in the heart arteries, which is the plumbing system of the heart, for which a lot of times we use stents, which are those springs or metallic scaffolds that are intended at keeping arteries open. And then there's also heart disease, heart valve disease, where you can have obstructions and malfunction of the opening of the heart valves.
All these blockages are dangerous and potentially fatal. And Dr. Vasquez says there are multiple reasons for these blockages to happen. Most importantly, diet and genetics. In Huntsville, he sees these types of blockages the most.
We see a variation of different things. When you talk about electrical issues, by far the most common problem is what we call and know as atrial fibrillation, which is not an obstruction of the electrical system, or rather a disorganized electrical activity of the heart chambers, usually the top chamber that we call the atria, and therefore the name atrial fibrillation.
Although you can't control genetics, you can control exercise.
You always think of exercise and you think of the person that is out in the street running and having this suffering expression. It doesn't have to be that. And we know that you don't have to overwork to get or derive the benefits from exercise. You can exercise 20 to 30 minutes, 2 to 3 times a week, and that is usually enough to gain the benefits, the cardiac benefits of exercise.
People forget that your heart is, in fact, a muscle.
Says Sodexo Regional Dietitian and Wellness Manager supporting campus dining, Christina Caro. Caro says the heart needs to be fed with proper fuel and definitely proper hydration,
so that our heart, our blood, and our energy are pumping for us to be able to do what we need to do each and every day.
Caro says throughout her experience at various universities, it is obvious that student life can be very busy.
If we can make some healthful choices tying in with what we want, with what we need, then that can be a nice symbiotic relationship where that you're healthy and happy and you don't feel deprived.
And Crestwood Medical Center cardiologist Dr. William Snyder says if you are experiencing any chest pain, discomfort, or pressure, these are common heart disease symptoms.
Running out of energy, being more short of breath, filling up with some extra fluid, or seeing swelling in their legs, they should certainly contact their primary care physician or an urgent care in that situation.
Dr. Snyder says some other small things we all can do every day is be more active.
Such as taking the stairs at work, parking a little bit farther away in the parking lot.
Carol says another important thing to note is when you're going from coffee to energy drink to something else, that combination can create the possibility for a toxic caffeine level,
where it negatively impacts heart function.
Most importantly, when incorporating heart-healthy foods into your diet, have foods that are rich in potassium.
So instead of regular potato chips, maybe you can have kale chips or sweet potato chips. So that's going to give you still a little bit of the salty and the crunch.
You'll also get your antioxidants, which is great for total health and immune function.
Not just your heart. And then we also want to have fiber in our snacks,
which aids in digestion and helps lower cholesterol.
When someone feels chest discomfort or pain in the shoulders, jaw, or left arm, it's most likely someone may be experiencing a heart attack. Heart disease being the #1 killer globally, and heart attacks are quite common. What exactly is this attack?
In the heart arteries, plaque can develop within the lumen or the inner lining of the vessel. And if that plaque, which often has cholesterol and other particles in it, if the surface of the plaque cracks or breaks open, it sets off a cascade in your body to form a blood clot.
Dr. Green says that's how someone can go from being totally fine to having a heart attack. Now, things can be worse for someone who has 100% blockage.
If the blood vessels that supply the heart muscle happen to close completely, then every minute that the heart muscle goes without blood flow, there's irreversible damage to the muscle that can then lead to a lot of symptoms later in life. And
full blockage or not, doctors will then try to save their patient with a stent. You probably have heard about a stent, but how does it work?
And so we work through a fancy straw, oftentimes through the arm, that we take up to the heart and then selectively place that straw right at the start of those little blood vessels. And then we take a wire that's about 0.014 inches in diameter and push the wire gently across the blockage. And if it's a fresh blockage, oftentimes that blood clot dissolves very quickly with blood thinners that we give during the procedure. And then over the wire, we're able to rail a balloon over an even smaller straw, inflate the balloon, and that pushes the plaque out of the way. Once we can see the blood vessel clearly.
Once the blood vessel is clear, the stent is left, which is a metal scaffold that is mounted in the vessel. Now, there is a way to prevent from having a stent and, most importantly, a heart attack. Dr. Green says stop smoking. Even vaping is a threat. Check your blood pressure regularly, and if you do experience the symptoms of chest discomfort, don't mistake it for indigestion. Dr. Green says call 911 immediately.
This is sort of where I spend my day.
He calls himself an electrician, not the one that works on your home, but your heart. This is his office where he performs surgeries scheduled and on the spot. One of the main types of procedures he sees, atrial fibrillation.
It's the most common rhythm problem we see in America. About 1 in 3 to 4 Alabamians will have AFib before the age of 75, so it's quite common.
It's also responsible for a quarter of strokes that happen in America. But how does one know if they are affected?
It becomes very irregular in pattern. Oftentimes people will feel the heart palpating or racing, flip-flopping, things of that nature. They can feel more short of breath or fatigued or weak.
Dr. Tabarot has even seen it with people who have had fevers, post-op surgeries, or admitted for COVID.
It depends. We've seen some people have it with their acute illness. So if a patient comes in with COVID, gets admitted to the ICU, and then develops AFib, it's actually a marker of poor outcome. But we've seen plenty of people just have what feels like rapid heartbeat or AFib in the weeks following COVID.
Now, how do doctors like Tabarot treat AFib?
And so when we go inside the heart, what we're often doing is cauterizing areas. And you can use different types of things to heat different types of energy sources in order to create the ablation. You can use heat, which is the most common. We use an energy source called RF, radio frequency ablation. It's a lot like a microwave where we're just cooking the tissue. One of my partners does a lot of ablation with cryo, which is sort of a freezing catheter, and it just freezes the tissue. And just like when you get something super cold and it burns, it can cause that same sort of energy.
There are ways to prevent from having this procedure that are very similar to any heart disease. Monitor your weight, blood pressure. Wearing a CPAP may help regulate your heart as well.
Okay, so next week, Wednesday, which is Hypertension Day, May 17th, from 12 to 4, we're going to be offering free blood pressure screenings. And if the person that comes in has high blood pressure, we're also going to be giving away free blood pressure monitors.
Central North Alabama Health Services Incorporation case manager Chantel Rachel says this day is very important for several reasons.
Having that screening, being able to check your blood pressure, how you're doing this morning, how are you doing in the evening, that can help with bringing awareness to how your blood pressure is, but also in what you need to do to lower that or keep it steady.
Family nurse practitioner Virginia Hunt says her first time meeting some of her patients is after they've let their blood pressure get out of control.
So we really try to encourage patients to at least come in, do an annual visit, let us check your blood pressure, talk to you about any habits that are contributing to that, such as smoking, a sedentary lifestyle. Obesity is a huge contributing factor to uncontrolled blood pressure.
According to the Alabama Department of Public Health, over 42% of Alabamians reported having high blood pressure in 2021. Given that high blood pressure is a major risk factor for heart disease and stroke, regular blood pressure monitoring is essential for optimal heart health. Central North Alabama Health Services Incorporation Director of Public Relations and Marketing, Iola Rios, says for those who have hypertension, it becomes even more important to have a treatment plan and to work with your provider.
So I wanted to give a warm welcome to anyone that is looking for a provider to establish care somewhere. We are accepting new patients.
And for those who may be uninsured and meet criteria eligibility,
living at 200% or below the federal poverty guidelines, they may qualify for this program, which again makes care affordable and allows people to see a primary care provider.
Lastly, Rachel says this is another important highlight to note for next Wednesday.
So also on May 17th, for those that have high blood pressure, they come in. If they are a patient here, they will be enrolled what is called remote blood pressure monitoring program, and that is specifically for those that have hypertension. We give them the device, and case managers are able to monitor them. They check it, and we can see on the app how their readings are doing, and we ask them how they're taking their medication. Sometimes we talk with the doctors, okay, this medication, we're taking this medication, but their blood pressure is still high. What should we do? So it's more of a hands-on, outside of these four walls, still checking that blood pressure on our end and their end.